adult onset asthma is usually A. Intrinsic asthma, B. Extrinsic asthma, C. Atopic asthma, D. Have raised IgE level.
Let's clear one of the classic traps, adult onset asthma. Many students automatically think extrinsic because they link asthma with allergy. But adult onset asthma is actually intrinsic asthma. That's your key phrase. Here's your hook. Think of adult equal sign alone, meaning not triggered by outside allergens. So, unlike the kids who come in sneezing from dust mites, adults often test negative on skin allergy tests. The total IgE may even be normal, though sometimes the airway has local IgE production.
Aspirin. Sensitive asthma is associated with A. Extrinsic asthma, B. Usually associated with urticaria, C. Associated with nasal polyp, D. Obesity.
In for intrinsic, reminding you that adult asthma comes from inside, not from environmental allergens. Simple, right? Aspirin sensitive asthma. Alright, team, here's a high yield triad asthma, nasal polyp, and aspirin reaction. That's the classic presentation of aspirin exacerbated respiratory disease or AORD. The question loves to tempt you with urticaria, but that's not part of the defining triad. The real triad is what I call PAN polyp, asthma, and NSAID reaction. Mechanism when COX1 is blocked by aspirin, it shunts arachidonic acid metabolism toward leukotriene production, leading to bronchospasm and nasal congestion. So, whenever you see asthma flaring up after painkillers and chronic sinus symptoms, think pain, polyp, asthma, NSAID. Easy to score.
Which of the following is not seen in bronchial asthma? A. Hypertrophy of the bronchial smooth muscle. B. Hyperplasia of mucosal and submucosal vessels. C. Mucosal edema. D. Thin basement membrane.
Let's talk pathology. Bronchial asthma under the microscope. The question asks which of these is not seen. The false option is thin basement membrane. In truth, asthma has a thickened basement membrane due to subepithelial fibrosis. That's one of the most characteristic features. Remember the remodeling rule of 3H's hypertrophy of smooth muscle, hyperplasia of vessels and glands, and hyaline thickening of the basement membrane. Mnemonic asthma builds heavy H's. It builds thickness, not thins.
Which of the following is a selective attractant to eosinophils via CCR3 in asthmatics? A. Eotaxin. B. Eotarg, CCL17. C. MDC, CCL22. D. CCR4.
Let's get into immunology. Who calls the eosinophils to the airway party? The master attractant is eotaxin, also known as CCL11. Think of the word eotaxin, literally means taxi for eosinophils. It binds to the CCR3 receptor, guiding eosinophils straight to the inflamed bronchial wall. Tip, remember this with EO drives 3 cabs, eotaxin, rho CCR3 attracts eosinophils. The trio all start with EO3, so link them that way. So next time the MCQ asks for the selective attractant for eosinophils, no confusion, it's eotaxin, the Uber for eosinophils.
Bronchial asthma is associated with increase in A. Leukotrienes, B. PGI2, C. PGE2, D. Thromboxane.
Here's a pharmacology crossover. Which lipid mediator increases in asthma? The answer, leukotrienes. Specifically, the cysteine leukotrienes LC4, LT4, and LT4 are the villains behind bronchoconstriction and airway edema. Remember, L is for leukotrienes, lock the airway tight. Compare that with prostaglandins like PGI2 and PGE2, which are actually the good guys, they dilate the airway. So your recall tip, leukotrienes equals sign lock, prostaglandins equals sign protect. That's how you never miss this one again.
Which is not true regarding asthma triggering factors? A. Most common allergen to trigger asthma is dermatophagoides SPB. RSV and coronavirus are the commonest triggers of acute severe exacerbations in adults. C. Exercise-induced asthma is linked to hyperventilation, causing osmolar changes in airway lining fluid. D. Premenstrual worsening of asthma is recognized.
Alright, future pulmonologists, here's a golden high yield chart topic. Asthma triggers. The question asks what's not true. The wrong option is RSV and coronavirus being the main adult triggers. Nope. The big culprit in adults is actually rhinovirus. You can remember it with the clue adults catch rhino, not RSV. The rest are true. The dust mite dermatophagoides is the number one allergen. Think derma equal sign dust equal sign dominant allergen. Exercise induced asthma happens due to airway cooling and drying linked to hyperventilation. Picture an athlete gasping in cold air. And yes, premenstrual worsening is very real due to hormonal effect on airway reactivity. Mometic to recall triggers. Drew, asterisk dust, rhino, exercise, women, premenstrual. Asterisk easy.
Reversibility is traditionally defined as a diatic acetic increase in FEV1 after an inhaled V agonist. A. 10%, B. 12%, C. 13%, D. 15%.
Let's move to spirometry. They'll definitely test you on this. How do you define reversibility in asthma? It's an increase in FEV1 of TG 12% and DG 200 milliliters after giving an inhaled beta agonist like salbutamol. The quick tip, remember 1-2 rule, one test, two numbers, 12% and 200 milliliters. That's straight from the ATS and GINA guidelines. This distinction helps separate asthma from COPD. COPD barely shows reversibility, while asthma breathes back to life after a bronchodilator.